Hear me. My name is Amber Hasselberger, and I thank you for joining me on what we're doing today. I really appreciate this opportunity to, whoop, that always happens the first time we do these things, so bear with me here. Okay. Again, my name is Amber Hasselberger. I'm with Interim HealthCare. I am a care consultant, but I am a social worker by background. I worked solely with the hospice team prior to becoming a care consultant, and my role, generally speaking, is to kind of help bridge people to services, within Interim's scope here. And I guess I want to first start out by thanking everybody in the community for kind of what's going on, and just thank you for all that you're doing, whether you are a clinician, whether you work for a home care hospice, whether you work at an assisted living, or whether you are just family, kind of in this new the new role, and just this overall kind of crazy new world that we're living in here. And so I thank you for all that everybody is doing. I appreciate it immensely, and so does Interim HealthCare. I guess I'd like to first start out by saying, this is kind of like a new normal for everybody. We have people working from home now. There's been losses of jobs, losses of resources, families who, at one time were going in to see their loved ones maybe on a daily basis, and now are no longer able to get into those communities to see their loved ones. And so we at Interim recognize, all of those obstacles that families are facing. We recognize the obstacles that communities are facing, kind of all of those new stressors. And so, we are working diligently with those communities, with families to kind of streamline and be of any of assistance that we can. And so, whatever we need to do to help out those communities or help out family members, we will do whatever we can to make it go as smooth as possible for everybody. And so we recognize the stress, and that's kind of what we're here for as clinicians, to be of support to communities and to families and patients out there. And so I guess the purpose of being on this forum here twice a week is, not only to kind of come together while we're apart, so to speak, but, we're coming together to kind of share resources, talk about things that, are of stress out there, maybe talk about what is out there for resources for families and clinicians and communities. And maybe you're jumping on this not to, learn of those things, but maybe just feel a sense of community. A lot of us are kind of isolated in our own homes right now. And so this kind of forum kind of brings us a sense of community right now. And so I'm in hopes that after this kind of gets going, that people will start to join and start to ask some questions, and hopefully I have some answers for you, or it will create some great discussion amongst all of us, or maybe just bring, again, a sense of community to those who are otherwise kind of isolated in their own homes. This is meant for anybody, for families, for clinicians out in the communities, to residents, anybody who would like to jump on and kind of gain that extra support or ask some of those questions. That's what this is intended for. So, I hope it just brings a sense of community for everybody. And, we're all going through those kind of new losses, these new normals that we're trying to grow accustomed to. Those feelings are a sense of grief. We are grieving all of those things, those routines that we once had, even as clinicians, even as residents in those assisted living buildings who, at one point, maybe we're attending activities every day, or we're, having a sense of community in the dining room to, those things are all those are all losses. Having family no longer being able to come and see you, that's a sense of loss. And so, we're all kind of going through these series of losses, and it adds kind of that extra layer of grief, so to speak. And so I'm in hopes that as we all kind of gather on here together, we can kind of talk through some of those things, hopefully talk about some resource options if they're available, talk about what Interim HealthCare can provide, and how we can be of support to all of you in the community. So Interim HealthCare has 3 service lines. We have our home health care benefit. And, like I mentioned before, some of you out in the community probably have seen a lot of our clinicians out in the buildings. We do have partner sites in which you would see a lot of our PTAs, our physical therapists out there. Interim is following the CDC guidelines right now. And so some of you may have seen a lot of our clinicians kind of pull back out of those buildings a little bit because we are following the CDC guidelines. Now, we are working with each individual community. And so, whatever their practice is right now, we are doing our best to honor whatever that may be. And so, if we're allowed to come in and do some of those therapies, absolutely, we will come in and do those. We will kind of work in collaboration with whatever those building policies are. And so we just want to be, again, of that support to the building and to the patient. But like I said before, Interim HealthCare, we do have home health. It does fall under your Medicare benefit. And your physician does have to deem you need for that skilled service and that intermittent service. And so in conjunction with your physician, there does have to be a medically necessary need identified. Now, with that being said, with this COVID-19 and all of these things that are going on, we're seeing, surgeries being, postponed. Sometimes families don't necessarily feel comfortable maybe putting their loved one in a TCU right now for rehab. Depression plays a big factor in things. You have patients that are isolated in their apartments, and these assisted livings are doing a wonderful job, trying to integrate activities as best as they can. They're trying to fulfill that void and we're seeing amazing things being done in these communities, but again, it's just the new normal. And so we might be seeing some of that depression set in with these patients, with that isolation in their apartments. Some deconditioning possibly going on with patients because they perhaps might have had some therapies earlier, but due to COVID-19, some of those were put on hold. And so we're kind of in that era right now where you're noticing maybe some restrictions are being lifted a little bit. Gives us kind of an opportunity to come in and help the staff in some of these communities and help the patient. And so with our the home care benefit under Interim, we do have the nursing service. We have physical therapy, occupational speech therapy, wound care, and I'll kind of go over each one in a little bit more detail, but we have all of these wonderful therapies that can help support your loved one in the community right now, in conjunction with whatever those community stipulations are right now. So I guess my biggest recommendation to people would be to call us, and we can kind of help work through that referral process for whatever therapy that you may be thinking that your loved one may need. And our intake team can kind of work through that with you, can obtain those physician's orders if needed, and kind of explain how it would all work in conjunction with the building that they're in, or if they're in a private home. But as far as like our nursing services can help with pain management, disease management, symptom management, a lot of teaching and training our nurses do, and they kind of overall manage that patient care plan. as far as PT goes, they do a lot of, overall assessment, therapeutic exercises, gait training, range of motion, balance improvement, endurance. You might notice that your loved one is kind of possibly deconditioning right now because of COVID-19 and just that isolation in their apartment. And so you might notice, they possibly they're having difficulty going from maybe like sit to stand, or their gait seems a little off. They're moving a little bit slower. They're having some balance issues. Those would all warrant a PT referral. Speech therapy. They can do a lot of, swallowing. They work with swallowing issues. Diagnosis and treatment of dysphagia, speech and language disorders. Our occupational therapists, they work a lot with activities of daily living. If you're noticing that your loved one is having increased issues with, bathing, dressing, toileting, those types of things. Maybe you're noticing some cognitive decline. Our occupational therapists can assess for any cognitive decline. And then our medical social worker kind of helps with that psychosocial intervention type piece, can help with accessing available resources. Maybe some financial issues are going on. We can bring in our medical social worker to help with those things. And then lastly, our home health aide benefit. And so they will kind of come in if nursing is involved and maybe help with some bathing, dressing, ambulation under those therapy programs. And so as you can see, we have this wide range of therapy programs right now that can truly, if you're noticing any changes whatsoever in your loved one, we can come in and kind of assess what those needs are and kind of help put together a care plan to address those. So like I said, you can call Interim HealthCare 7 days a week, 24 hours a day. I'll leave the phone number here at the end, but we would love to be in and those buildings and working with you guys. So lastly, our hospice program. And this program, I shouldn't say lastly, we do have our, we called it Home Styles for quite a while. So many of you possibly knew us under Home Styles, but we actually just recently kind of rebranded our program, and it is called PCSS, Personal Care Support Services. And essentially it is a private pay program. They do work with long-term care insurance. And so what I would encourage anyone to do if they have interest in this program is to, again, call our office and they can kind of work with you and your long-term care insurance if you have it. But ideally it is a private pay program. And the way I typically describe it is, it's similar to like a home health aide program. And a lot of times people get confused between the two, to be honest with you. But PCSS is truly, it's a wonderful program. If you have maybe your mom or dad, you've noticed need some extra support in their home, whether that be a private home or an assisted living. Maybe they were cooking their own meals at one time. Maybe they were bathing themselves at one time independently. Maybe they are no longer able to get to the store. PCSS can provide that one-on-one caregiver to come in the home at an hourly rate and help with those things around the home. Possibly help with, the bathing, the meal prep, the housekeeping, just kind of be that one-on-one support. It also can be, maybe they're coming home from the hospital and they're needing that extra support for maybe a short period of time. Maybe they need 24-hour care. The hospital's telling you that, possibly you can't go home without 24-hour care. That would be a wonderful reason to use private pay services. Whatever that reason may be, that one-on-one caregiver is there to kind of bring peace of mind to you and your family. And so a lot of times I say to families, if you are the son or the daughter and you're doing a lot of those cares already, and especially during this time with COVID, the COVID-19 going on, now you're juggling a job at home. Maybe you're working from home. Maybe you have your kids at home, and you were once helping your mom and your dad in home, throughout the week. Private pay services would be a wonderful addition to kind of provide that one-on-one care when you are juggling all of these new responsibilities. It allows you to be that child and that's your mom and dad. So you can go and visit your mom and dad and not have to be that caregiver. Maybe you want to be there for a certain number of hours a day, and then have PCSS come in for maybe 8 hours a day, or just that overnight service. And so they kind of help bridge those services and bridge those gaps that you're seeing. I always suggest to families, it's better to get a service like PCSS involved early than later. Reason being is you're able to establish a relationship with a private duty home care agency right away. So you've established that relationship, you've kind of bridged the service gap early on. You've allowed your loved one to kind of create a relationship with that caregiver. And so if and when you need, very much so increased hours, that relationship is already there. There is a minimum hour requirement with PCSS, but I really encourage you to call and kind of talk through that with our office. They will create a care plan that suits your family and your loved one to what those needs are. And so it's a wonderful program. We use it quite often in hospice and home care because it really bridges all of those gaps and keeps people safe. And then lastly, hospice. I love to talk about hospice because I work in hospice. I could talk all day about hospice, but hospice is such a wonderful benefit. It is for people in those last stages of life. And especially right now, I think people are identifying probably with hospice more so because we're seeing all of these things in the news. Everything's right in front of our face right now. We're experiencing new fears and new losses. We're trying to find meaning in everything that is going on around us, and meaning is so important. And we're kind of, in a way, being stripped of that meaning in a way because, we find meaning in our funeral processes and our family rituals, in our our different cultural rituals. All of those things bring us meaning when things are going on. And right now during COVID-19, those things are somewhat being kind of taken away because we're having to find a new normal. And it's adding kind of an extra layer of grief onto an already difficult process. Hospice is sometimes already a difficult thing to talk about. There's that stigma we hear with hospice a lot of times. And so we try to kind of dispel some of those myths when we meet with patients and families. And it's we're talking about death and dying. And now you're adding an extra layer of what's going on in this world. I'm not able to see my loved one as I once was. All of those what ifs are kind of coming into play. And so hospice is just so important, I think, because we have this whole team that kind of surrounds, the family and the patient. It may look a little different right now given COVID-19, but that team is still there. So with hospice, in order to qualify for hospice, you need 2 physicians that kind of give that okay, that say, yes, I believe this patient qualifies. There are certain diagnoses that qualify somebody for hospice. Our process at Interim has changed slightly, and in the fact that we do have to follow those CDC guidelines, and also we have to we have to recognize that each community also has their own guidelines. And so we're trying to follow both and trying to work collectively together, again, to meet both the patient's needs, the community's needs, and the family's needs. And so right now we're trying to be very creative in what we're doing. We might send a nurse out to pre-screen a patient for hospice. We might ask a community to send us paperwork on a patient and kind of pre-screen them that way. We're still having those conversations with families. A lot of them are done via Skype, via phone, or if a family would like to meet with us, we are able to meet. We just kind of go through those precautions per CDC guidelines to do so. Those conversations are so important, those early conversations about hospice. We love to sit down with families and have those conversations. And I think what makes it, again, sometimes even more difficult is if we can't sit down face to face, but we are still having those important conversations, whether they're via the phone or Skype. We try to adapt to whatever families feel most comfortable with. And so, with that admission process, we can do admissions 24 hours a day, 7 days a week. Again, you just give our office a call and we will coordinate that and get things in place for that admission process. As far as our hospice team goes, we do have an RN who would see that patient. We have two RNs on call 24 hours a day, 7 days a week for whatever needs may arise. We also have a social worker and spiritual care on call 24/7. But our team consists of an RN, a social work and spiritual care, music and massage therapy, and we also have a home health aide, and we also have a wonderful bereavement program. And during COVID-19, I think, our clinicians are identifying those bereavement needs early on. Our bereavement coordinator is truly wonderful, and she follows families 13 months after somebody passes. However, with kind of the environment that we're seeing now, a lot of our clinicians are identifying the need for early bereavement. And so she's been so wonderful in reaching out to those families to offer that support early on, recognizing that need and some of this complicated grief that we might be seeing because of all of these changes. And so, with kind of what we're seeing in the communities, a lot of them are limiting to essential visitors only. And so we are sending our nurse out as an essential visitor, but a lot of our clinicians, such as our therapies and our social work and our spiritual care, we are making those frequent phone calls to families, Skype visits to families, being of that extra layer of support to those families in this crisis that we're seeing. And, trying to find meaning, in kind of this chaos in this world right now. And so what does meaning look like for families? How do we help them find meaning in all of what's going on right now? And so, again, it just, this just adds that extra layer of grief on for families and for communities who were used to seeing families and having that extra layer of support coming in with their patients. And so how, does home care and hospice kind of help best support that need? And I know that I personally can say that I work with a bunch of wonderful, wonderful people who truly have hearts of gold and are doing this because this is a calling for them. And we want to be there for people in the community. We want to be there for families and for patients. And whatever we can do to best support that, we will. And so to reach Interim, our phone is answered 24/7, and you would need to call 651-917-3634. 651-917-3634. That phone is answered 24 hours a day, 7 days a week, whether it is for PCSS, home care, or hospice. Even if you just have a question, even if you're not quite sure if you need services, you're not quite sure if you qualify for services, please call us because we are more than happy to talk with you and kind of work through all of those questions that you have. We don't expect you to know all of this. That's what we're here for. So even more so now, I would say just give us a call. You know, that's what we're here for. We're here for that added support. So I'm hoping that after a few of these sessions, we'll get people on from the community to start asking some great questions. You know, trying to be of support to each other, using this as kind of a forum to build that community. And again, just like we said before, kind of being together while we're so far apart. But I feel very much, I kind of feel gratitude just being able to be on here and talking with you all, and you know, feeling that sense of community. It's so important. So please reach out anytime. If you have questions or concerns, please reach out to us. Again, it's 651-917-3634. And I hope you have a wonderful rest of your day. Thank you.